Hello, everyone. Welcome to Orthopod. I'm here with Vikas Khanduja, who is a colleague and respected friend. He's a consultant young adult hip surgeon, as you can see here at the University of Cambridge. He's an associate lecturer at Cambridge University and an associate editor at the Bone and Joint Journal. He's with us today with some really interesting work he's been doing worldwide. And rather than me explain it, I'll let him kind of take it from here. Vikas, welcome.
Thank you very much, Mo, for having me on your Orthopod.
Very good. So you've been up to quite a bit of stuff during this unfortunate period we've had, but the work you've been doing, I think, is really important, and we're keen to get this message out. So maybe you could kind of walk us through some of the highlights of some of this research.
Sure. So, Mo, essentially, I think it was around March 11th when the WHO declared it as a pandemic, this COVID-19. And just around that time, I think the inspiration for this probably goes to an article by Atul Gawande, where he specifically spoke about healthcare workers and protection of them and the numbers getting infected. But unfortunately, there was not much science to it, so that really kicked it off for me. And then there were a few newspaper articles as well, and a letter in BMJ which came out about specifically about healthcare workers. And we wanted to see what was going on worldwide. And because the pandemic was quite high at that particular point in time in the Far East, and the aim was if we could actually learn from what they have done so that we could implement those changes and decrease the number of healthcare workers being infected, that would be great. So we really wanted to learn from what exactly is going on in that part of the world and then implement those changes within our system. And that was the sort of ethos behind doing this study. At the same time, we realized that there was an immense amount of confusion at that particular point in time, the first 2 weeks, as to how should we be managing both patients and infected healthcare workers. There were immense amount of shortages in personal protective equipment, in healthcare workers going off sick because we had to protect them. And 2 weeks in the UK, it was 2 weeks at that time. There was immense amount of shortages in bed space and ventilators. So along with that, there was a lot of this commotion and this lacunae in specific guidelines for healthcare workers. So that really prompted this study, and we wanted to learn from variation in practice and exactly what was going on. So we designed this cross-sectional survey, and what we really wanted was to get a good spread of the whole world, and it was a fairly simple survey with 10 questions, both open and closed. So open questions so that we could actually get qualitative analysis done, and closed questions so that we could compare the data. And we tried to capture pretty much the whole world and get a sense of what was going on. So we had 27 orthopedic surgeons from 22 countries spanning 6 continents who were actually taking part in the survey. And if you look at the WHO world meter, then essentially we covered about 57.5% of the world population with 6.6 million healthcare workers in this survey. So pretty decent representative sample of what was going on at that particular point in time. And so that was the methodology. And we wanted to identify differences and obviously areas of good practice as well. So places like Hong Kong, South Korea actually had good policies in place already. So we had asked each place to send us their policies as well so that we could actually compare and contrast and then come up with specific recommendations. So that was the methodology and the ethos behind it.
So when you think about the impact that this has, because right now, you know, more than any other time, like the cycle of information is shifting so quickly. So for example, what was relevant a week ago, as you know, is no longer relevant, and we're moving forward. This is actually very, very timely because, sorry again. So this is actually very, very timely because what you're seeing now is, you know, reopening around the world, and you're also understanding with reopening becomes even greater concern and risk for frontline healthcare workers. Did you get a sense from the survey, and I suspect that you'll speak to some of the key learning points, but did you get a sense from the survey also that there's a sense of fatigue or burnout. I mean, that's an issue that we're starting to see more and more of. And I know it wasn't maybe specifically maybe captured, but was there a sentiment of how people are going to actually manage the frontline workers in terms of rotations, in terms of, because people need breaks, and I think they're quite fatigued from this last 12 weeks. And then to say to them, we're reopening orthopedic surgery, we're going to need an additional amount of effort because we have to get through that backlog, which is mounting and mounting and mounting. Any thoughts on that?
So I think you're absolutely right. We did this survey in last week of March. Before the final sort of manuscript went out, we had another update on the numbers on the 5th of April. And obviously, by the time it's come out, it's fairly time-sensitive information. I'm hoping that the recommendations that we've made are actually already in place in all the units. However, having said that, I think if you look at the peak now in South America, I think these recommendations would be extremely helpful for that region. And coming to your second point about fatigue, yes, so we've got that included. And again, sharing experiences from South Korea and Hong Kong, they had it in place already. So about staff rotation, about making sure that you had well-being lessons being conducted, online sessions on well-being, making sure that they had enough breaks and leave was actually mandatory for them. So all that was actually being included in the good guidelines which Hong Kong and South Korea had, and we've included that in our recommendations.
From your perspective and looking at the world and looking at how things are going, where are we currently doing a good job in terms of where do you think everyone is aligned with protocols, and where do you think there's opportunities, I guess, to educate, and make sure that your work gets out to the world? Because I'm sure there's probably going to be a variety of what we consider exemplary models and models that can learn from those exemplary models. Do you have a sense of how common some of these features were?
So I think what we're doing well throughout, or what we've learned from this survey at least, is that we're limiting exposure for our staff. So I think that we're doing well. Most centers are doing that extremely well in terms of rotation of the staff. Actually, if they had any issues in terms of symptoms and they were self-isolating, and enough and appropriate support was being given to them, and rotation as well. So good rotas, and pretty much all places were doing that. The variation was in the amount of PPE and exactly in terms of what's the right word to put it, the evidence behind what PPE should you use in which setting. So how much amount of PPE would you want to be using in the outpatient setting? What PPE do you need in the COVID negative wards? What PPE do you need COVID positive? And I think theaters, we had pretty much a good response from everybody, and they were pretty standard. So everybody was using level 3 PPE in theaters. But I think the other two areas, there is certainly scope for improvement and some evidence out there as well to actually help. The other place we could certainly improve upon is communication. So there are some places which were leading by example and communicating with their staff on a daily basis, giving them updates as to exactly what was happening, and some places were not doing that. The visitor policies were very variable. So there were some hospitals wherein you have pretty much like a small hut outside the hospital. Before anybody enters, you're going to get tested, you're going to be screened, and only then you could enter the hospital, whereas some hospitals didn't have that policy. So again, visitor policy and making sure that the people who enter the hospital are actually free of infection. There's certainly room for improvement there and a scope there. So that's pretty much what we found from this survey.
So where do you go from here with this information, Vikas? I mean, you've got a lot of insight and information. What's the next step from this project?
So that's a very good question, and for me, I'm thinking like an evidence-based scientist, pretty much like you, inspiring figure like you. So I want to, these are just guidelines and some recommendations. I would want to put more science behind this and take a couple of areas, for example, the outpatients, and really do some good work into what is the level of PPE required in those areas based on true science. And the second bit that we want to do, which is already in place, is to do a Delphi among 50 orthopedic surgeons from around the world and actually get a consensus on where we need PPE, what sort of PPE, and what is the risk profile that we want to be actually using for the patient actually who's going to have an operation. So that's the next stage really. Which patient should be having the procedures? What is the risk there? And we need stratification of them. So that's the two bits of work that I would like to actually do, and one of them we've already commenced on.
Well, that's wonderful. So in terms of, and maybe I'll end on this one, Vikas, is you've spent a lot of time thinking about this issue. And I wonder if, you have any insights, just reflections for what for you has been the key learning. What have you taken away from all this experience that we've been in? And I'm sure you've reflected on it. So I'm curious about your own thoughts on this.
So sure, Mohit, I think I've reflected quite a bit on this. And I think the two things that come out big for me on this are that in times of crisis, we collaborate extremely well. This survey was open for 4 days, 23rd to 27th of March, and we had 100% response rate within 48 hours. Everybody responded. Then I needed to get the paper in by the 5th of April, and I emailed them on the 4th saying that we need updated numbers. And by the 5th, before we actually sent the paper in, everybody had responded. So I think collaboration and speed in times of crisis were the two things that actually stood out the most for me. And that's what I've taken. So I'd like to take this opportunity to thank all the collaborators who were great actually on submitting the data and collaborating on the study. And I'd also like to mention Hussain, Zaman Hussain, who was a medical student with us and now in Boston, who helped us immensely with this timely production of this paper. So those two.
Wonderful. Well, I can't thank you enough for taking time out of your schedule. I know things for many things have gotten slow, but for some they've gotten busier and busier. And I know from firsthand experience, you've probably been the busiest you've ever been in sharing evidence, getting information out, and developing new educational platforms across all the associations in which you're doing a tremendous job. So on that note, Dr. Khanduja, thank you so much for taking time with us today.